Good afternoon, everyone. If we'll start settling in, sign-up sheet to my right on the white table to the gallery's left there. If anybody else, we have one person only signed up at this time. If anybody else would like to sign up to speak on the measure as we settle in. Okay, we want to know here. David wants to know if he's in a short chair. Does he look shorter than the chair? Yeah, you need to get a taller chair, David.
Appreciate you doing that.
Okay, I think we have some folks that may be joining us, but we'll go ahead. There's a number of things going on in the afternoon, including the Senate still at work over there and the possible Senate rules meeting. So we'll go ahead and call this meeting of the Sales Tax Subcommittee of the House Ways and Means Committee to order this afternoon, March 27th. We have one item on the agenda for a hearing today is HB 83. Representative, you want to tell us about your proposition? We're working for the same the original bill, is it 500959? Yes, ma'am. Tell us about your proposition.
Thank you. Oh, can I take this off? Just need a little more room. Sorry.
IT is going to kill me, but I think.
There we go. I need more space to spread out. All righty. So good afternoon, everyone. Sorry, I'm going to put this lower. Much shorter than everyone. So thank you to the committee for allowing me to present HB 83. And this is a bill that proposes a strategy to decrease the burden on Georgians for supporting smokers' health care costs. So approximately 1 in 5 deaths in the United States are attributed to cigarette use, and tobacco use is also linked to over 20 chronic health conditions which incur substantial healthcare costs, estimated about $600 billion annually in the United States. Since adults who are enrolled in Medicaid smoke cigarettes at a rate more than twice as high as that of privately insured adults, a lot of this cost ultimately ends up being borne by the states. So what HB 83 seeks to do is ensure that those costs are more directly borne by those who choose to smoke cigarettes. At present, Georgia actually has the second lowest tobacco tax in the nation. The national average for a state tobacco tax is, for a pack of cigarettes, it's $1.97. Okay, Georgia's tax for a pack of cigarettes, however, is only 37 cents. And the last time we changed this was in 2003, which is over 2 decades ago. So in your packets, you can take a look at a bunch of things that I thought might be instructive for this conversation. You can see the state cigarette tax rates in our neighboring peer states, and you can also see where Georgia ranks among all 50 states and the District of Columbia. So our rate is obviously set very, very low. So, before you say, good, we like a lower cigarette sales tax because lower sales taxes are good, regardless of the item being taxed, I just want to point out a few things. So number one, 49 states and the District of Columbia have increased their cigarette taxes since 2002, and many have done it more than once. So Georgia's an outlier in this sense. Number two, generally states have raised their cigarette taxes, and when they do that, they've seen a drop in their rates of cigarette smoking. And what this translates to, relevant to this committee, is a drop in state health care costs for the chronic health conditions that result from smoking. So raising the state cigarette tax drives down state expenses. Okay? So number three, raising the state cigarette tax means that people who choose to buy cigarettes take that personal responsibility for the health care costs incurred by their choice to smoke. So think of the cigarette tax as a user's fee. right? Everyone has the personal freedom to smoke cigarettes, but people who choose to smoke cigarettes should not unduly saddle other taxpayers with the costs for their health care. This is especially true for Medicaid patients who smoke, again, at a rate twice as high as that of the average population with private insurance. So that's basically what HB 83 proposes. It proposes a very modest raise in the state cigarette tax from 37 cents to 57 cents. Okay, that's a 20-cent increase or a rise in 1 cent per cigarette. So let me explain to you how we came up with that number. And Representative Stevens is familiar with this process that we went through in a bipartisan manner to come up with this figure. Obviously, we recognize that Georgia's cigarette tax is much, much, much lower than the national average, which is, again, $1.97 per pack. We wanted to make sure that any adjustment was tailored specifically for Georgia and tailored to regional levels. So the 57-cent increase is based on a regional average. So we looked at the cigarette tax of every state that touches Georgia. We dropped the highest and the lowest, which would be Florida. Florida has the highest. North Carolina has the lowest, and we averaged the rest. Florida, I'm going to just note, just so we can calibrate the numbers we're thinking about. Florida has the highest state cigarette tax in the region at $1.34. And there actually is no neighboring state with a cigarette tax that is lower than ours. So one reason we decided to go this way with the regional average is to protect our small businesses, in particular our convenience stores, especially those stores that are near our bordering states. We're also sensitive to the anxiety that customers might drive to neighboring states to buy their cigarettes for cheaper, and we wanted to pitch the price at a point where, given the time and the price of gas, it would not be worthwhile to do that, to protect small businesses, in particular our convenience stores. I'm going to answer just a few common questions right here to streamline the committee process and to save you guys from having to ask it. The first is that HB 83 only addresses the cigarette tax. It does not propose any changes to the tax for cigars, for snuff, for vapes, or for nicotine pouches. The second is that there has been considerable bipartisan interest in both chambers on this issue for many years. And some of you may, in fact, remember that this bill was presented to you last term by my co-sponsor and my good friend, Representative Ron Stevens. The third thing is that this bill may have particular relevance and utility this year. We may be looking at some uncertainty with respect to our federal Medicaid match funding, for which we receive significant federal assistance. So modernizing the cigarette user's fee on a subset of Medicaid patients which tend to incur higher healthcare costs may be a reasonable strategy for addressing these costs without drawing money away from other state health priorities, such as, for example, DBHDD funding our mental health programs. I'm just going to keep this short. So in sum, this bill would aim to modernize the user's fee for patients who elect to partake in a costly behavior that drives up state healthcare costs. In passing this bill and looking to our experience in other states, most of which have done this already, we could improve the health of the state, drive down those costs, and ensure that individuals partaking in the costly behavior would more directly be contributing to that cost and care that they will likely incur. And with that, I'd be happy to answer any questions that the committee has.
Committee have any questions of the representative? Any questions at this time?
Did I answer them all?
You don't have any questions,
All right.
please.
I have a couple people to testify.
Yes, ma'am. We'll get back to you here. Danny Canso, am I saying, Danny, I should know. Am I doing that, or is it Canso? Okay. Couldn't remember how the A was pronounced in there. Yes, sir. Tell us who you are and who you're representing, or if you're speaking as an individual.
Absolutely. Thank you, Mr. Chairman. Danny Kansa, I'm here on behalf of the Georgia Budget and Policy Institute, where I work as Senior Fiscal Analyst and Director of Legislative Strategy. And thank you so much to Representative Au and to Chairman Stevens for bringing HB 83 forward. We're strongly supportive of this legislation. And just want to walk you through a few key points. We really do see the tobacco tax as a common sense user fee that accounts for the public costs of cigarette use. So all 50 states, as Representative Al said, assess an excise tax on cigarettes, and they do that for two primary reasons. The first reason is to raise revenue in a way that accounts for the related social and public health costs of tobacco use. And the second reason is actually to discourage cigarette smoking and cigarette use, because we know that cigarettes are the leading contributor to preventable deaths in the United States. So I won't belabor this because, as Representative Al explained, where Georgia stands, obviously we're 49th out of 50 nationally. We have a lower rate on cigarettes than all of our neighboring states, which range from Florida at $1.34 to South Carolina at 57 cents. That are included in this calculation here, how Representative Al and Representative Stevens arrived at 57 cents. But I do want to briefly discuss kind of our analysis of HB 83 and how we see this affecting the state budget. So our best estimate for the number of cigarettes sold every year in Georgia is 318.6 million packs per year. And so we take that from previous fiscal notes, work that the state has already done. And so based on Governor Kemp's revenue estimate for 2026, the state expects cigarette sales to make up about 57% of tobacco tax revenues. So tobacco tax revenues as a whole are about $208 million in 2026. Cigarettes alone represent about $118 million of that. So certainly the lion's share of tobacco revenues, and also when we look at cigarettes, they are the leading contributor, smoking of deaths. So that's why cigarettes in particular are really selected here for the tax. So if we were to lift the cigarette tax from where we are right now, 37 cents a pack, to 57 cents a pack in 2026, we would anticipate a revenue increase of about $63.7 million. So that would bring our total cigarette revenues up to about $182 million per year from where we are right now, again, at about $118 million. So that is a significant increase. But under this scenario, we would still just be scratching the surface of applying the cigarette tax as a user fee on the cost of smoking. I'll also just mention, because it's relevant, that we do get $148 million per year still in tobacco settlement funds. So even if we include that, we still are pretty far below where we are, even in Medicaid. If we take Medicaid alone, the best estimate right now is that about $699 million in Medicaid costs are directly attributable to smoking. And so just kind of one statistic that I think summarizes that picture is that about 30% of all cancer deaths in Georgia are associated with smoking. And so from everything that we know, obviously a relatively small percentage of Medicaid enrollees drive a fairly high percentage of the overall program costs. Smoking is certainly a leading contributor to that. So if we use that $699 million as a baseline, we apply our current funding that we're getting from tobacco settlements, and even this enhanced figure, we're still about 50 to 60% of the cost to Medicaid alone. So just thinking about this as a user fee, certainly applying those funds would help us to address costs that we're already incurring, that other taxpayers right now are having to have their tax dollars go to essentially subsidize within the existing budget. And I'll also just note, that as Representative Al kind of preempted, that if folks were to stop smoking or avoid picking up smoking as a result of us implementing this measure, it would be a net positive. We know that research has already shown some very positive associations with lifting tobacco taxes in other states and seeing maternal and infant health outcomes improved because of those reductions in smoking. So I know there's other testimony today and that y'all have had a very long day, but I'll pause for any questions and just again say thank you for your consideration and to the sponsors for bringing this forward.
Thank you, Mr. Canso. Any questions for the gentleman? The gentleman is willing to take questions? No questions for you. Okay. Thank you very much.
Thank you.
Miss Angela Holland, if you would introduce yourself and tell us with whom you're, who's joining you, or are you speaking as an individual?
Thank you, Mr. Chairman and members of the committee. I am Angela Holland. I serve as the president of the Georgia Association of Convenience Stores. We represent about 2,000 of the 7,000 stores in this state. We have multi-generational businesses as well as corporate locations. And it is no secret that we have opposed cigarette tax increase, I guess, since Godzilla was a lizard. And so just want to go on record saying that we oppose any tax increase on tobacco. Thank you. And I'd be glad taking questions.
Any questions for Ms. Holland? Thank you, ma'am. Mr. Lord, Andy Lord. Yep. Who's with you this afternoon, Mr. Lord?
Hey, good afternoon, Mr. Chairman, members of the committee. I'm Andy Lord. I'm here on behalf of the Georgia Society of Clinical Oncology. This is a oncology group that is, we have over 200 offices statewide. I'm here to thank Dr. Al for bringing this bill. We think it's an important piece of legislation that we've obviously been supportive of for a number of years from the oncology cancer standpoint. A couple of points I do want to underscore to build on some of the testimony that was previously rendered is, number one, if we were to look at our tobacco tax in Georgia through the lens of a business, we often say in Georgia we need to run Georgia more like a business. We certainly agree with that. If we look at the free market business model for healthcare, let's take one of our larger insurers, for example, Blue Cross. What we will note about them is that they charge higher premiums for their members that smoke, and that's because those members create a higher risk. As was noted, Georgia is also an insurer. We call it Medicaid. As was noted earlier, we spent last year about $699 million in Medicaid alone treating tobacco-related disease, so about $700 million. As was also noted, our tobacco tax brought in a little under $200 million. That is a $500 million per year delta between what we spend treating tobacco-related disease and what we bring in through the tax. We don't believe there's any business model out there that would look at such a deficit and not want to take action as a business. We can also look to our own state health benefit plan. A number of years ago, the state health benefit plan decided to add a surcharge to our state employees who are tobacco users. This is for the same reason that Blue Cross and others do it as well, of course, which is simply put, smoking puts you at a higher risk. There's higher cost associated with that risk, whether that's Medicaid or the state health benefit plan. So we have a precedent somewhat already established through our state health plan. This is a user fee in the classic sense. The only scenario under which you pay this tax is if you're using the product, and when you're using the product, you are putting the greater burden on the healthcare system, as we mentioned. One thing I do want to drill down on a little bit is one of the pushback points that we often get when we're talking about increasing tobacco taxes, despite the fact that we are the 49th ranked in tobacco tax, is we often talk about declining revenue that would come from decreased consumption. We often get the question, well, hey, if you increase the price and people stop using it or consumption goes down, then revenue will go down accordingly. And this seems very intuitive. In reality, that is not what happens. And to use an example, and I'll use a overreach example. I know it's not what is in the bill, but if we were to say, for example, to use a round figure, that we were going to increase Georgia's tobacco tax by $1. That's not what I'm asking for today. That's not what this bill calls for. But for the sake of this argument, what we would see is, so Georgia right now, when we sell a carton of cigarettes, we make $3.70 of tax revenue. That's 37 cents a pack. If we were to increase it by $1 in this hypothetical, Consumption, according to the data, would go down about 12%. There'd be a little bit of black market. There'd be a little bit of cross-border sales. If you factor consumption declines, cross-border sales, black market into the equation, we're going to lose about 12 to 15%. So now imagine that I've got 2 cartons of cigarettes, one at 37 cents, which is our current tax rate. We do nothing about it. We're going to sell all 10 of those packs, and we're going to make $3.70. Let's say, hypothetically, that was $1.37. And we had a consumption decline, cross-border sales of 15%. Let's even round it up to 20%. That would mean you would take 2 packs out of this 10-pack carton. Never going to sell those. Our detractors are right. Consumption will go down. There will be some cross-border. There will be some black market. So take out that 20%. But you've still got 8 packs in this carton at $1.37, and that comes out to over $10. So in this example, what we would be saying is that we could decrease smoking by 20% and still triple the revenue from the tobacco tax, and then we could use that revenue to offset the $699 million deficit that we, or the $500 million deficit that we have currently in our Medicaid budget. So in our mind, any legislation raising the tobacco tax remains revenue neutral at worst, at least until you hit that threshold of $500 million, if that makes sense, because that is the deficit that we see in our Medicaid budget. So we have a national average tobacco tax, but it's kind of hidden in the Medicaid budget. We're spending the money. It is in there. Final point, Mr. Chairman and members, is that we've got good math. One of the great things about a tobacco tax is that it is more predictable than sales taxes. It's more predictable than income taxes. In fact, it's more predictable than any other tax revenue source. In part, that's because it's an addictive product. In part, that is because every other state has raised their tobacco tax multiple times, and the data pool for other states that have done this is both a mile wide and a mile deep. So what we know is that if we were what we know is that when we are estimating revenue from tobacco taxes, that for every penny that we raise our tobacco tax in Georgia, that it would generate about $5 million a year in new revenue. So, and if you do the rough math on where we are now at 37 cents and the 180 to 200 million that we typically bring in, you will see that our current tobacco tax brings in about $5.5 million per penny. So when we are looking at budget holes, when we are looking at budget gaps, when we're looking at rural hospitals that are closing, when we're looking at Medicaid provider reimbursement rates that are well below the national average, et cetera, there are some good ways for us to be able to calculate and predict, very safely predict the revenue even after consumption declines, cross-border and black market. Very safe ways for us to predict what is a very stable source of revenue. So that's all I have, Mr. Chairman.
Thank you, Mr. Lord. Would you, I have a light blinking here. I suspect this question. Would you stand for questions?
Oh, of course.
Chairman Stevens.
Thank you, Mr. Chairman. Wouldn't you agree that even if, worst case scenario, and even if it did happen, if revenue went down, prices go up, that the savings, the healthcare savings long term are going to be more significant than the loss of revenue from the increase in tax?
I think there's no debate about that. Again, the data pool is a mile wide and a mile deep. Every other state, since we last raised our tobacco tax, it was in Sonny Perdue's first year, you all may recall, and we went from 12 cents a pack to 37 cents a pack. But there are states in the interim, since we last raised it, that have increased their tobacco taxes 3 or 4 times even. Multiple times states have gone back to this to equalize their Medicaid budget. So you are absolutely correct that we do see those, we will of course see those long-term savings in Medicaid, and that is something we certainly promote. But very importantly, we do not have to wait to see those revenue increases. The revenue increases will be immediate. and they will be consequential. And in Georgia, again, the math is you raise it by 1 cent today, we'll have $5 million in new revenue. And again, if you divide round up a little bit to 200 million of what we came in with last year and divide that by the 37 cents, you'll see that figure holds. So we will see the long-term savings. But we will also see immediate and short-term savings. This is a decision that any business would make. There is no business that looks at a $500 million a year shortfall from one of their products that says, no need to take action. And as we do stare down the barrel of some uncertainty that may be in the pipeline with regard to Medicaid, we certainly think that this is another way for Georgia to have more of a locus of control over our own budget. We wouldn't have to rely on federal dollars perhaps as much for Medicaid. And again, we see the impact that tobacco, we don't dispute anybody's right to smoke at all. We do maybe dispute that we should all be paying that surcharge. So the personal responsibility here for us is that the person using the product that's placing the disproportionate burden on the healthcare system should be helping to pay for that rather than those that choose not to. Thank you for the question, Chairman Stevens.
Any further questions? I have a question I want to throw out to
Yes.
you, and then I'm going to ask Dr. Al if she's come back. And I'm not picking at anybody when I do this. This is a math thing. But I was doing the math really quick. 63. Am I right, Dr. Al? You think the 20 cents would raise about 63.7 million? Was, okay. Yeah. Okay. So yeah. I'm not picking. So I divide that, and then you would divide that by 20 cents, correct? Because the 20 cents additional pack. So if I take, that's 318 million, and I divide that by 365 days. Anyway, my question is, put a pin to that, and I know there's a question for Dr. Al. I'm going to do the same thing here, and I'm trying to get to the number of people that would have to smoke this much to get to those numbers. But I mean, I'm not questioning them. I'm just trying to, kind of wanted to sound out for the committee the numbers we were talking about when we were doing this. But if you would do that while
I want to make
Dr.
sure I
Al
understand the question. You're saying what daily consumption would have to go down?
Right. I was just looking at how we get back to the daily consumption. I think it would be kind of mind-boggling, how much it actually is. It was
Historically, the way they calculate that is what the percentage decline is tethered directly to and predictably to the percentage.
Not to interrupt you, but I'm not even trying to get into analytics of the percentage decline. I'm just looking at if 63 divided by 20 cents, that would be this many packs divided by 365 days a year. And it's just going to be a pretty massive number of cigarettes that are being consumed in Georgia, which may be the reason we're leading to some of our health problems. So thank you. Okay. Did you have something for Mr. Lord?
Representative.
Okay. To the representative.
And I have that number of packs smoked if you need it.
Awesome. Thank you.
So many numbers.
If you would, let me get to Chairman Hilton's question here, and then we'll get back to the numbers. Thank you. Chairman Hilton.
Representative, I think we're both wanting the same outcome, which is fewer smokers. I think where we may disagree is the policy to get us to that outcome. And this year, as you know, I introduced and that you signed on to House Bill 506, allow Medicaid to cover smoking cessation products with the ultimate goal of fewer folks on Medicaid smoking. Where I struggle twofold. Number one, the elasticity between prevalence of smoking and taxes. So this handout you provided us here, New York has a tax rate that's 15 times higher than Georgia. Yet the prevalence of smokers is only about 1.5% to 2% different. That would lead me to believe that we could increase our tax 15-fold and only see a marginal difference. And in doing so, add a pretty substantial regressive tax on those who can least afford it. I guess comment on that and your viewpoint on the elasticity between price and prevalence.
Absolutely. So 2 things on that. One is to make a point about the regressive tax. Sales taxes are inherently regressive. right? And people will say, you're placing this burden on people who cannot afford it because people who are lower income do tend to smoke at higher rates, as indicated by the Medicaid patient population smoking at twice as high a rate as the private insurance. One thing I will note when we talk about this, though, is that unlike things like food or medicine or clothing or schools, no one has to smoke, right? It is a choice, right? And in terms of the elasticity of who will continue to smoke and who will forego smoking when the price does go up, certainly we have noted that when the price goes up, some people will choose to stop smoking because of that price increase. Not everyone will. We recognize that smoking and nicotine is an addictive behavior, which makes it less elastic than maybe some other goods in an absolute economic sense. And this is sort of the key point, is that the people who are most sensitive to price and are most likely to be dissuaded from continuing to smoke cigarettes or starting to smoke cigarettes are actually younger smokers, right? Because younger people, as we know, are more sensitive to price increases. So this gets at the point of not just the revenue generation of increasing the tobacco tax, but the savings in healthcare costs by increasing the tax, right? We're coming at it from both ends. So in that sense, it's a win-win. We increase the revenue, we decrease the healthcare costs. So for a younger smoker to be dissuaded from smoking, and disproportionately younger smokers will be more sensitive to this price, we are gaining decades of improved life year quality and decreased healthcare costs, as opposed to dissuading, let's say, an 83-year-old smoker from smoking. Those smokers are more likely locked in and addicted, so I agree that the impact is probably not equal throughout because of those social and biological reasons.
So smoking in the United States is at an 80-year low. A lot of that attributable to, and I guess you would argue more tax. I would maybe argue educational programs, youth access laws that have kind of driven that down. I mean, in Georgia here, and I don't have the numbers in front of me. I mean, it's as low as 2-3% prevalence amongst, young smokers. I mean, it just seems like through educational programs and what we've done there, it's driven it down more so than, I mean, for a state that has the lowest in the nation, and yet we're on par with just about everyone else. We're middle of the pack, I'd say, in terms of prevalence. I just question whether or not tax is the right policy lever we want to pull.
Well, I think what we've seen nationally, it is the most effective lever to decrease smoking. And I know this is obviously something you care about because of your bill to fund smoking cessation treatments through Medicaid. So I think these are actually bills that we can think of as thematically paired or partnered, because a bill to encourage covering smoking cessation treatments through Medicaid, that money has to come out of somewhere. So there is some sort of internal logic to having the patients who are smoking and may want to quit help fund that treatment, in addition to funding the healthcare costs for the chronic medical conditions that they develop from smoking.
So last question. As we know, we've just been coming out of 4-year high, or really 40-year high inflation on all sorts of products. I imagine that a pack of cigarettes is no different, and it's experienced inflation along with every other product. Do you know what that price has increased, and has that had an impact on smoking prevalence?
I can maybe ask our friend from GPBI if they know the rise in the absolute cost separate from the tax, but I will note that since you bring up inflation, that the fact that the tax has not increased for 20 years is notable given the rate of inflation. The other thing I'm going to bring up is, we're talking about 37 cents is where we are now, and we alluded to Governor Sonny Perdue being the one to raise the tax in 2003. Governor Perdue's original proposal for raising the state tobacco tax was up to 58 cents, right? And where he ended up on was 37 cents, where we have been for the past 2 decades plus. But that original proposal was actually higher than what I'm proposing today, right? So I think that when you talk about inflation, this should be part of that conversation. And certainly healthcare costs have gone up as well at rates that exceed inflation.
Thank you.
You're welcome.
I'm just going to take a bit of privilege here. Ms. Holland, do you care to answer a question from your seat? Because I must admit I do not know the answer to this, and I should. Does one pay sales tax in addition to the excise tax? Does anybody in the room know? Because I've never bought a pack of cigarettes.
So excise tax is paid to the wholesale
Right. So these are not something that would come, okay, that was just curious if it was in addition to. I just wanted to make sure about it. I know the excise tax is paid at a different place. I just didn't know if because there was an excise tax paid, there wasn't a sales tax paid. Okay. Do you have something further? I'm good. Okay. Okay, so this is, and I don't want to belabor this afternoon, but I was running through this. So if you do the math on it, it's something over 800,000, for the numbers to work out, 800,000 packs a day. I suspect that's what you had something close to
The
there,
figures I
yes?
have, number of packs of cigarettes sold in 2026 projected going to be about 320 million packs.
Mine was, I divided, it was 316, so,
pretty
a million
close.
here, a million there.
Human
before you-
calculator.
Right, so there you go. So it's 800,000 packs a day. That, I just wonder how many Georgians are doing it, and it was just kind of the scope is all I was trying to get. I didn't really have a point to make other than it's spread out over a lot of people to get to that number. Yeah, are there further questions for the lady? Further questions? If not, Representative, thank you for doing this. I mean, you've, brought something before us, and I'll get with Chairman Blackman and see where we go next. And I'm sure he'll be in touch with you.
All right.
So thank you very
Thank you so
much. That was the item we had before the Sales Tax Subcommittee this afternoon. Does anyone have anything else for the good of the order? Anything else? Hearing none, if there's no objection, we'll adjourn without objection. I hear no objection. We stand adjourned.